Why do you think you mentioned healthcare, why do you think the elements of lean management have resonated so well? They seem to be resonating very well with the healthcare community.
Well, healthcare everywhere is under crisis, not just in the United States, where you spend a tremendous amount of money and don't get better outcomes. Every healthcare system suffers from the same problems. It's basically been a system that has been run by craft professionals in a completely ad hoc hospital context, in which the standard management is essentially workarounds. And the nurses were skilled, and even the docs were skilled at working around a completely broken system. So if we want to introduce some stability and some consistency and some focus on the patient and the patient's experience of the process and improving that experience, then we also have to introduce not just the basic tools of operational management of the process and the patient's journey, but we also have to build a new management system to support that, because in many cases that doesn't exist. And so the identification of the need to manage the patient's journey and synchronize all of the activities that are necessary to solve the patient's problem, that's a task in itself. And many healthcare organizations have focused on improving quality, on point improvements in quality, are now realizing that actually there is another task that will also help that quality improvement, and that is to manage the patient's journey. But that needs a different management system that was completely absent.
And that's a horizontal journey through.
It's a horizontal
through the silos
Absolutely.
Of whatever.
Absolutely. You know, 120 different departments in a hospital, and patients wander through those departments, and each of those departments was traditionally managing their own affairs. And now you recognize that actually there are only really two kinds of flows through hospitals. There's the emergency flow, people who are just coming in the door, and there's the planned flow of elective procedures and so on. And they go through very common steps that were not recognized before as common steps. And the criticality of providing the right test results, the right support, the right therapies, the right drugs and so on, all at the right time, at the right place, and that was not there before, and now has been raised to the surface. And now we're seeing organizations recognizing that, or hospital organizations and whole healthcare systems recognizing that they need to build a modern management infrastructure, a lean management infrastructure to manage this process. So it's been a revolution that has just begun in healthcare, and all we've done so far is actually make the existing hospital structures work a lot better. But there's a huge rising demand that will mean that we cannot simply just make existing institutions better. We're actually going to have to fundamentally develop completely new ways of managing healthcare with patients.
So the hospital of the future is going to look completely.
The hospital of the future is going to look fundamentally different. And we're just at that point where we're beginning to see experiments being conducted in alternative ways of working with patients to manage healthcare problems that don't necessarily involve the hospital, might involve the hospital, might not. And out of those experiments, I think we will see a very different healthcare industry emerge in 15 years' time. But the revolution has absolutely started everywhere in healthcare, simply because the crisis, the financial crisis, and also the crisis of growing demand from...
It's remarkable and energizing, really. I mean,
Yes.
it's remarkable. In the last 10 years, you would never have guessed. But the uptake of lean thinking and practice in healthcare, pretty much globally, has been remarkable.
And how do you see the healthcare community responding to this revolution? Does the fact that lean management is so much based on a scientific method of plan, do, check, act, does that...
But you talk to doctors and you say to doctors, look, what we're trying to do is we're trying to use the same scientific approach to diagnosing and treating organizational problems as you use to treat medical problems. And they say, oh yeah, why wouldn't you do that? And then you say, well, actually, why aren't you doing that, doctor? Well, actually, I'd never thought of it. I just thought of the medical problem, and I just see the patient sitting in front of me in a room. I don't see the system. I don't actually care about the system, as long as the patient that I need to see next arrives on time. And when you point this out, that actually there's a complete dichotomy between how they think we should act and how we do act, they begin to say, oh, yeah, we should do something about that.
It's quite remarkable, by the way, what happened in society. And whether children were taught this or they just figured it out, but people thought, I thought, when I was an adult, that you do science in the laboratory where you have absolute control. And then out in life, you can't really do science, you use common sense, you try things. And so it comes as really a sort of to people in all professions when you say, well, gee, why don't you try science in your profession? Not as a laboratory discipline, I mean, that's fine, do that, but as a management discipline. What? How could we do that? And so what went wrong? How is it that the science got locked in the lab and the world went on, and look, life is about doing experiments, but without any actual definition of the experiment, without any discussion at the start about what evidence you're going to collect at the end to see whether you have confirmed your hypothesis. So an awful lot of what you guys have been doing and what you've been writing about is how to turn everybody into a scientist. Whereas in fact hardly anybody was a scientist except a few people in laboratories. That's a strange, wrong turn that society took in 1500 or whatever. And the professionalization of science, which, by the way, it can only be done by professionals in laboratories. And that's been a persistent issue with all improvement activities, is that professionals want to capture it and turn it into a functional expertise that only they can employ. And again, what we've tried to do is say, let's make everybody a scientist. And let's have everyone doing experiments. And by the way, why do you need a massive improvement staff? You need a little, I think, for the long-term improvement staff. Shouldn't every manager and every group of people be continuously involved in running experiments?
Yes.
So it's a curious thing, what people want to hear, what people did hear, what people should have heard.
Yeah, I think we've lost sight of what science is really about. And science is as much about the conducting of rigorous experiments and of learning the scientific method by doing it every day, which is essential core element of Kaizen. It's repeated practice, just like learning a musical instrument or a sport, is getting better at it. But it loses sight of the other aspect of science, which is actually framing the questions about the future we don't know. And if you look at the history of modern medicine, all of the discoveries were discovered in places you would not expect, kind of by accident, but it wasn't by accident. It was because somebody had a question, a burning question, could frame a burning question in his mind and define a problem that there must be an answer to, but I don't quite know where it's going to come from. And then suddenly, by accident, they discover the answer to that question, or a hypothesis, or a way forward. So actually, it's the excitement. They were actually thinking about the problem, defining the problem. And that's the hardest thing to do, is to define the business problem we're facing. People will actually avoid doing that and will jump to a solution.
And that's at every level.
At every level. And what we need to do is both conduct experiments, but also get much better at framing the question in the first place.
I think I think that's very much, agree 100%. It gets back to Jim's point about somehow things got off rails, and we thought that science was something you do in laboratories. We defined science and made it exactly one and the same, with a pretty narrow definition of the scientific method. And I think even a few years ago, having this conversation, we would have used the term scientific method a lot more than we are now, because we're talking about doing science, which means asking questions to understand how things work, understand causality. And there are a lot of ways of going about that. And when you want to make everyone into a scientist, there's a basic thinking, and we use, plan, do, check, act as a simple construct to think about it. But how you will do that in real world, which is very messy, is not quite the same as it is in a laboratory. The thinking there is essentially the same. And that's what we want to have everyone. And that is one of the lessons that Toyota does give us. If you go back to what they were doing, starting in the 1950s, making every factory worker, even on an assembly line, into scientists. Now, no one at Toyota was using those words, that terminology back then, but that's what they were doing. They're teaching people how to recognize normal from abnormal, to frame good questions, and then to try things, and then learn from that, and then make improvements based on it.
The other mistake is to think that we're looking for the answer. And in medicine, yes, you are looking for an underlying, repeatable pattern of behavior, of consequences, of causality. in business, all of the problems we face are situational. They are specific and complex, and what we're looking for isn't basic laws. What we're looking for is a practice thought process that has gone through many PDCA cycles, that is better able and has a much richer set of hypotheses about what might be the solution to this problem. So actually, it's the scientific method itself in business that we're trying to build. And that's the end result. It isn't solving today's problem, it's actually the ability to better solve tomorrow's and the next day's and the next day's problem. That's the ultimate objective of Lean. So we're not trying to look for laws, we're trying to look for stronger hypotheses that we might deploy to address specific problems. And so actually, I think the science actually really, in the end, this is the purest form of science, actually. In the most complex causality, structure, and system that we can possibly imagine. And if we all learn from school upwards how to practice daily this problem solving in every aspect of our lives, we will have organizations that can adapt to ever-changing circumstances much, much more readily and find solutions to seemingly intractable problems in our lives. So I think that's the ultimate true role of science in business, is actually this practice of developing better hypotheses to understand a very complex world.
It's asking what is useful. It's very empirical, and it's not getting trapped in dogma. And that leads to a totally different approach to science that's appropriate for business. Because with the multiple causality that goes on, it is a bit different from a laboratory, but how can you bring that same thinking and practice in for everyone that's involved? And then everyone can be an owner of their own experiments.